The world is witnessing a triple crisis: the COVID-19 pandemic, racial discrimination and inequality, and climate change. But I will focus on the twin crises of COVID-19 and child rights today. The impact of COVID-19 on human rights. We cannot talk about child rights without discussing human rights. So you would see a lot coming through on human rights issues. There have been multiple analyses conducted over the past few months on the impact of COVID on human rights, including child rights, and it's clear that COVID-19 has exposed actually long-standing, deep-seated, systemic human rights violation and child rights violation again across the world. Two, that COVID-19 has still and will continue to exacerbate this pre-existing violation, as well as create new human rights and child rights violation, which I'll talk about, especially for those that are already affected by this violation, such as children living in poverty or children from already marginalized or minority groups, or groups that are any group that is suffering from discrimination, the other, as society would call them. For the purpose of this discussion, it is important that we refer explicitly to human rights violation and child violation, so that we broaden this discussion on the vulnerability or inequality faced by children. And in so doing, then we can talk about the implications for child protection. Now, a lot of people have asked me, why does it matter that human rights and child rights are prioritized in the midst of a public health emergency? It matters for children. It is grave and it is pivotal time in the world. It's a grave and pivotal time in the world, and we were just talking about it. In several contexts, COVID-19 is proactively being used to hide or justify a rollback of human rights and therefore child rights standards. For example, in the areas of climate change, freedom of movement, online or digital privacy, following due process in judicial matters, or even the determination of a migration status of somebody, of a child, right? This is happening through the enactment of emergency legislation or de facto emergency legislation. At times, the legislation is hidden in the passage of a public health legislation or regulation, and they're having profound impact on children as well as adults. In some contexts, COVID-19 has been used for the suppression or targeting of specific individuals and groups, and we have seen it in some countries. Let me just walk through how this emergency power is being used to target freedom of expression, freedom of information, freedom of association, freedom of assembly, right? The emergency power, actually, the authorities have used this power to selectively ban protests on the grounds that they are countering harmful speeches, silence critics and scapegoated minorities, and close the political space. Yesterday, actually, we were having a conversation about justice for children. And there was a young person in the room who had gone to prison and is now a justice for children activist. And he says, when they ever say that actually we are doing this for public safety, you have to listen carefully and you have to unpack what public safety means. He says public safety means for children on the street that you would be taken away without due process, that you would be arrested on status laws, right? Public safety means actually that those who do not comply or those who cannot afford to comply will be arrested, and it could be used against the minority. So last year we saw it was a year of mass protests, which swept 6 continents, brought down 5 governments: Algeria, Bolivia, Iraq, Lebanon, Sudan. It forced others to rethink unpopular policies: Chile, France, Hong Kong. This year, by contrast, governments have banned mass gathering as part of the COVID-19 containment, okay, to enforce social distances. For example, in India, which had the biggest campaign of civil resistance for decades. Where is it now? It's gone, okay? The fight against the proposed changes in the citizen law, the discriminations against Muslims, it's gone. You don't see the protests anymore. Authorities have also used cohesive measures which they have applied in a heavy-handed and disproportionate way. Cases of excessive force to enforce measures to restrict movement, including arrest and detention. We know 59 countries where the police assaulted civilians and detained them, and in 66 countries because they were linked to the pandemic, okay, and protesting. Violence was most common in countries Freedom House is classified as partly free, where people are not yet too scared to protest, but their rulers would not like them to protest. Authorities have used emergency measures to harass dissidents and minority groups, and they've taken advantage of a general atmosphere of alarm. And they are building a narrative and an atmosphere in the country. For example, the Muslim Uyghurs, the Thailand king's grab of absolute power, the execution of 15 political prisoners in a single week in Egypt without not a peep. I don't think people even heard about it, right? Also, they're using the panic about the disease to promote, it's the authorities who are doing it, to promote irrationality and xenophobia. Okay, we see that actually in India, right? We see that in Bulgaria against the Roma population. We see that in Turkey against people of same sex. Even in Myanmar, the government has used it actually to target the Rohingyas. The government have used it to target actually migrant workers, which they call illegal interlopers. And the narrative they built is these are the people bringing the disease, right? And they have caned and deported some of them. The authorities have also restricted access to information, and we are worried about the freedom of expression of the press, the freedom, that space. They have criminalized fake news, right? It's now become, a common term, fake news. Often this means commentary that displeases whoever is the ruling party or the regime. Nicaragua has banned news, any news that causes alarm or anxiety. In Zimbabwe, anybody who publishes and disseminates false information about any officials that's working on the response could face up to 20 years imprisonment. So 2 journalists decided to go and visit 3 opposition activists. They were jailed, tortured, beaten up, right? In over several countries, actually, Reporters Without Borders have reported that 116 citizen journalists have been arrested. So in Egypt, actually, where the government says everything is fine with the pandemic, we are on top of it, actually. A dozen doctors who questioned and suggested otherwise were arrested, as several journalists, right? And the social media monitoring by government has increased, actually, on the pretext that they're monitoring fake news and false information. And they're disrupting their internet and disrupting access to Facebook, Twitter, etc. Data protection, they're undermining data protection, that they have to have access to the data of their citizen, right? They're not following any lawful procedures. It is not proportionate. It is not time-bound. It is not justified by any legitimate public health objectives, that you have to have access to the data of your citizen, where they are, how they're using their phone, and what they're doing, etc. They have used technologies, including artificial intelligence and big data, to enforce emergency and security restrictions. There is a country, it's Israel. If you quarantine and you step out of your house, the next moment, actually, somebody will be there. They will know where you are. So actually, they are using this technique, and we've seen how it's been used actually as well in China. And what is justified during an emergency is now becoming normalized without any adequate safeguard. These powerful technologies actually are going to cause a lot of discrimination, intrusion, infringement on privacy, and it will be deployed against people or groups for purposes going far beyond the pandemic. We don't feel they're going to go back once they've unleashed these technologies on their population. They've attacked democracy through postponement of elections, actually, raising serious constitutional issues. Of the 24 countries that had national elections scheduled between June and August, 9 were disrupted by the pandemic. We've seen Sri Lanka, how they've dissolved the opposition-controlled parliament and did not allow, from March, and did not allow any fresh election in August, right? In the meantime, actually, he ran the country without any lawmakers. We've seen Hong Kong, what has happened in Hong Kong, right, on the democracy candidates, actually, for the September election, that it was delayed. We've seen Burundi, actually, how Burundi was also, how Burundi, the election in Burundi in May, and what they did was to say, if you come in as an election observer, you have to quarantine for 14 days. And by that time, the election would be over, right? But we know that safe election can be carried out, okay? We have seen actually South Korea carrying out an election, right? And again, actually, the popularism, those leaders who believe in popularism have used it to rack up significant growth in their approval rating. The prime minister in India, the leader in Philippines, the leader in Brazil, and of course, we've seen actually, even in some of the Western countries like the States, we've seen what has happened. We've seen in the UK what has happened, right? We've seen in some of the Eastern European countries what has happened. The authorities are also attacking the service providers, those who should provide services to children, those who should provide services to the elderly. The medical staff actually who have complained, as I said, in Egypt actually were rounded up. In China, they were trying to silence the doctors. It would have been different if they had listened to the doctors. In Turkey, they actually are also trying to silence the doctors and the medical population. I mean, you have seen the anti-scientific push against these medical practitioners actually and the scientific communities by these politicians, right? And the authorities have also used the opportunity to intensify conflict. We've seen it in Myanmar, right, where the conflict has been intensified. We've seen it in Yemen, we've seen it in Somalia, we've seen it in Syria, we've seen it in Afghanistan. But people are not taking it lying down. There's a pushback as well from the population. There are pushbacks, okay? There have been demonstration in Kyrgyzstan. We now see demonstration in Europe. Actually, we see demonstration and protest in Nigeria, in South Africa. We've seen it in Kenya. We've seen it in Belarus, actually. So there is hope. There is hope that people will push back, right? What does all this mean for children's right to protection? In some contexts, we've seen the government actually completely lost control to prevent and respond to the pandemic and what children would need. For example, the increased rates of violence against children in street situation, as I said, the sweeping away of those children on status laws. The children of minority groups, children on the move, children being denied their migration status, their refugee status, children in conflict with the law, as well as adolescents and young people who are participating in protests and demonstration. In some cases, the government have even failed to sustain law enforcement and also failed to protect women, old people, people with disability, people, same-sex people, as well as children actually from violence and abuse. But let me touch on a few of the socioeconomic aspects as well of this pandemic. Why does it matter? The poverty and household income, lack of household income implication has an implication for children as well. You know that actually COVID-19 has plunged the world into a recession with a potential and deep consequence and historical level of employment and deprivation. Tragically, actually, COVID-19 risks reversing decades of progress in the fight against poverty. And it's going to exacerbate the high level of inequality in countries and between countries. The number of people in extreme poverty, it is estimated, could skyrocket by 40 million to 60 million this year alone compared to before the crisis. So the effect on people and those who are in the formal and informal economy are different. Those in the informal economy are more affected. And the current crisis tried to push back the limited gains made on gender equality, and I'll talk about that. And you know that most of the people in the informal economy are female, so there is the issue of the feminization of poverty. increased poverty against women, and it's increasing their vulnerability to violence and abuse. And the issue of women's equal participation in the labor force is also an issue we should consider, right? It's going to be rolled back, and I'll talk about that. Migration accounts for almost 30% of workers in some of the most affected sectors in the OECD countries. The massive job loss means that remittance to the South, the global South, is going to be reduced, right? Governments have to grapple with the employment and income projection, okay? So governments are trying to do their best, but millions of jobs are at risk of being due to the disruption of business, the supply chain, etc. Everything is up in the air. Supply chains have been disrupted, businesses have been disrupted, right? But we see also how governments are applying fiscal stimulus, and it's unevenly distributed worldwide. So what we're seeing actually is even the response that governments are putting in place is there's inequality in the response. The estimated fiscal stimulus gap is around over 900 billion. So in low and middle income country, actually. And this gap represents the amount of resources that this country would need to match the stimulus actually that has been given in the West and in high income countries. So, and it's less than 1% of the total stimulus, this total value of the fiscal stimulus package that was done by the West. So actually, even the response, there is actually inequality in the response, actually. Parents all over the world are juggling work and care responsibility at home. They're coping with the loss of income and the challenges they're facing. And again, it has a gender face. Women are also disproportionately affected. They are the carers. So they are the ones staying at home. They're the ones dropping out of the workforce. They are also the majority of the workforce in the health and care work, right? So again, because they do not have any protection, they're the ones who are getting affected. And they're the ones actually who also lack the social protection support, actually, a safety net, right? So, I mean, definitely in terms of the socioeconomic implication, it has a gender face. And we should recognize that in any response. Inequality and poverty and the child protection implication, according to the figures we have, okay, the children who are living in poor households could increase by 15% by the end of 2020. And 2/3 of these households are in sub-Saharan Africa and South Asia, right? We know that actually the extreme inequality, we now see COVID-19, everybody now sees COVID-19 as a disequalizing event. We can see the event actually in education, in health, okay, that it's damaging children in the poorest country, and within this country, it's damaging children in the poorest household, and within the household, it has more implication for girls actually, right? And this is for the Sustainable Development Goal and leaving no one behind. We have to get our head around what this means. For example, this rise in poverty could lead to millions more children being pushed into child labor, which could lead to the first rise in child labor after 20 years of progress, as households are using every available means to survive. And we know that actually child labor becomes a coping mechanism for many families as poverty rises, school closes, and the availability of social service decreases. So children have been entering into the workforce 2 decades. For 2 decades, we've worked on child labor, and we've seen 94 million fewer children in child labor. That trend can be reversed, right? Also, actually, we have studies that show that for every percentage point rise in poverty, you'd have most probably a 0.7% increase in child labor. There are also similar evidence pointing to that this could also lead to a rise in child marriage. Estimates by UNFPA and several universities point to the risk of 13 million additional child marriage over the coming 10 years if we don't address this poverty. And this is due to the anticipated economic financial fallout, but it also to the disruption of programs for these girls. currently we cannot access the girls who were in clubs, who were in groups, okay, that we're working with, and I'll come to that. We've seen actually the spotlight on social protection, with countries introducing programs for social protection. When our colleagues counted, over 1,100 new social protection measures in 200 countries. And it represents a significant scale, and they're spending over 700 billion. But again, low-income countries, countries where conflicts are being waged, are not able to access these programs, right? I mean, countries who do not have the infrastructure to roll out such kind of sophisticated system, right? Again, as I spoke about these countries and those this equalizing, okay, effect of the pandemic, sophisticated distant learning solution. If you don't have internet, you cannot, you're not going to have it. Even in developed countries like the States, okay, the United States, we start seeing actually how certain families could not access the distant learning. They were dropping out. So just imagine a child in the Rohingya camps in Bangladesh, right? They would be dropping out actually. Poor households have little asset, they have less access to healthcare, and we've seen that. Actually, it depends on your income, it depends on your zip code, it depends on your lifestyle, right? And so all these things we see in health, social protection, do you understand how to access the social protection? Do you have internet in your house? Okay, do you have the device to learn? Do you have the parents to spend the time with you? All these things are coming to play. In some, actually, the world's poorest children are facing a precarious existence, actually, disproportionate to the pandemic. So as people try to break the chain of the transmission, they should look at actually these poor households, how they're adapting, right? How these poor households are trying to cope in terms of livelihood, in terms of continuing access to education for their children, in terms of continuing access to health for their children. So again, this is a hidden crisis, the child rights and the violence. Let me talk a bit about the violence and then I'll round up. We know that these new stressors arising from school closure, which we spoke about, the disruption of livelihood, the home confinement, the isolation, can be triggers for violence against children. We know that actually. We have this issue of if you have mental health in a parents with mental health problem, substance abuse, domestic violence, income issues, there's definitely, these are variables that would show that actually 10 chances to 1 there is going to be violence against children in that home. So 3 out of 4 children were regularly subject to violence discipline before the pandemic, okay? 1 in 4 were living with mothers who were physically abused by her partners. We have seen that the frequency and intensity has increased. In fact, actually, we are working on an analysis that shows that for children who are disabled, the frequency, right, of punishment increased during the pandemic. The parents actually could not understand why their children are hyper, okay? Locking up a child in a home, like the harsh containment and lockdown in Spain, where even children couldn't go out. They don't understand why their children are so hyper. And they themselves are stressed, actually. And the issue is, at the same time, the children are cut out from their social support, the extended family in the school, the community, where they could rely on somebody when they're in stress. What we have also seen actually is that children who are in distress are calling national helplines. For example, in India, okay, the child helpline received more than 92,000, okay, SOS calls for protection in the first 11 days of their lockdown. In South Africa, they were receiving 11,000 calls a month, with around a quarter of the calls being around violence and mental health related issues. But again, as I said, at the same time, we have seen actually a drop in the number of children who are reporting, in the number of reported cases of child abuse and neglect. Why? We have seen there have been studies in the States where during the holidays, the number of reported cases of child abuse and neglect drops. The number of cases reported to the authority drops. Then the school reopens and the cases shoot up once the kids come in contact with their teachers, because the teachers are the front line. They're the ones that see these kids. It's the same thing that we're seeing. There's a drop in the report, but there's an increase in the child helpline, right? So the children are not in contact with many of these adults in their community, in their churches and mosques, okay, any faith-based institution, with the welfare workers. And I'll talk about this disruption, okay? Again, another thing that has happened to children with the school closure, with them being confined to the home, billions of children who one day were in the physical world were shifted into the virtual world. And were we ready for that? No, we were not ready for that, okay? The National Center of Missing and Exploited Children has shown a 160% increase in reports of suspected sexual exploitation and abuse online. There have been law enforcement have listened in to discussions, actually, how people who abuse children were discussing that this is an opportunity with more children online, how they could have more victims to exploit, right? In Australia, actually, they have seen an increase also, about a monthly average of 27 and 37, between 27 and 37% of materials coming online. There are millions of materials that suddenly have surged online, actually, of sexual abuse and exploitation. Live streaming of children who have been sexually abused, actually, from the Philippines and elsewhere, right? And basically, actually, people can't police it, you know? So who should respond? Again, we did a study in 140 countries where over 1.8 billion children were living. And we saw actually that in these countries, services have been disrupted. And what is the services that have been disrupted? Is the violence prevention and response service, the case management service, the home visit for children and women at risk of abuse are the most commonly disrupted service, right? Amongst 2/3 of the country, they at least reported that at least one service has been severely disrupted. And we zoomed in on places like South Africa, Malaysia, Nigeria, Pakistan, South Asia, Eastern Europe, Central Asia. They were showing actually that really services have been severely disrupted. Children with disability no longer could have the face-to-face service that they need for health, education, and protection. I have a colleague of mine, okay, virtually her performance, her output dropped to 20%. She has to take over care of her disabled child, right? She has to, that's what she does. Round the clock, there is no service. Nobody can enter her home, right? And she can't go out to the service, you know? And we're talking about the United States. So just imagine what is happening elsewhere. Children with mental health problems, you can only, the mental health problem, I have a family member who has mental health problem. It's all about the telephone. You can hardly get any service if you have a mental health problem. It's been disrupted as well. And we know globally between 15 to 23% or 1 in 4 children live with parents who have a mental health problem. If you're a children on the move and a migrant child or refugee child, of the world, 13 million refugee children and those who reside in camps or crowded settlement, they're facing similar challenge. They've been denied actually their refugee status, they've been denied entry into countries, and services have been totally disrupted for them as well, as people can't go to the camps. Children who are deprived of their liberty, they have been deprived, services have been disrupted actually because people can't go to the centers. And we heard about people who were working in these centers, how they were getting sick actually. Children who were in, I'm talking about children who were in conflict with the law or youth offenders who were in detention, and also children who were in care home. Now, in sum, let me round up now. The international focus has been on disrupting the transmission. The international focus has been on responding to the socio-economic impact faced by the adults. They talk about children, but we saw actually the challenge in even devoting some resources to opening of schools, right? And how we should do it rightly. They should be considered in the planning, and it should be the full range, okay? It's not only the services for children. We are talking if children and adolescents want to participate and want to say something about their rights and want to say something about their society, we should look at their participation right. So we should also look at the civil and political and cultural rights, actually. And we shouldn't forget those in fragile and conflict contexts, because we're hearing very little about children who are in conflict situations. We're not hearing about the Yemen, we're not hearing about Syria, we're not hearing about DRC, we're not hearing about South Sudan, we're not hearing about Libya, right? Where are the voices, actually, of these children who are in conflict situation? We're not hearing about the children in the favelas. What's happening to them in the favelas? What's happening to them in Cox's Bazar, right? So, and they are involved, these young people are involved in social movements and are part of the social unrest. That's why I'm saying we should go beyond just providing them with services. And my final point here, as countries adopt preventive and control measures, we need to look at how they prioritize the services for those children across the board, okay? And the visit by the child welfare and the social workers to homes, actually, the helplines that we're talking about. And some, actually, we need a new narrative. We need a new narrative on investing in the young generation. We have to invest in the young generation. And the last time, actually, Keith responded to my saying from West Africa, actually, that when I said, if we do not take care of this young generation, as we say back home, who's going to take care of us when we're old and who's going to bury us? And Keith has said, well, if you're in the West, you can buy an insurance, right? But actually, you can buy an insurance, Keith. And my comeback on that one is, you need this generation to pay for the social protection and the retirement benefits of the older people, right? So we need to invest in this generation. We need to invest in this generation so that we do not have a lost generation. And I showed the human rights context, and we need to invest in this generation so that they respect this human rights context and they are not led astray, actually, into this popularism and authoritarian way of working, this anti-scientific way of thinking, actually. So let's build a new narrative for this generation. Thank you very much, and back to you, Everett.